Diabetes is a disorder where the blood sugar starts increasing. Basically, there is a deficiency of insulin in the body of this patient as well as insulin resistance, and that is why the patient's blood sugar starts increasing. Now, this blood sugar will have a bad impact on every organ, practically every organ of the body, and this leads to multiple complications which can affect the eye, heart, kidneys, nerves, and a whole lot of problems can happen because of this. Whenever I am asked this question by my patients, I always tell them that no symptom is the most common symptom of diabetes. You will wonder why. See, because 50% of diabetics do not have any symptom. Now the remaining 50% who actually have symptom may have too much of urine, too much of thirst, too much of hunger. They may have a urinary tract infection, vaginal infections, infections on the private parts. They may have dizziness, they may have weight loss, they may have change in the number of their specs. So multiple such problems can arise when the sugars fluctuate. The problem is usually when the sugars rise gradually, symptoms do not appear. And usually when it is a catastrophic event, the symptoms will appear. And as you know, diabetes is a silent disease, silent killer. So most of the patients will have a gradual increase in sugars, and that is why most of the patients won't have any symptoms. So if you are at high risk of developing diabetes, keep screening yourself every 6 monthly or at least once in a year as advised by your doctor. Diabetes can affect each and every organ of the body. Predominantly it affects the heart, the kidneys, the eyes and the nerves. So basically you can have increased chances of getting heart attacks or paralysis, eye related problems like retinopathy, foot related problems like neuropathy or diabetic foot, kidney related problems like kidney failure, and you may even eventually reach onto a stage where you require dialysis or renal transplant, kidney transplant. There are three types of heart related problems which can happen in a diabetic patient. The first, which is very common, heart attacks, that is called as myocardial infarction. The second, which is called as dilated cardiomyopathy. See, where the heart dilates. I mean, you must have heard that of certain patients, they have huge heart, that pumping gets impaired, and because of which they keep on getting repeated attacks of left ventricular failure. So this is the second type of problem which can happen in diabetes. The third type of problem which usually happen in a long-standing diabetic patient is autonomic dysfunction, whereby the patient's autonomic nervous system doesn't function properly, and that is why the patient finds a lot of problem in maintaining his blood pressure. Usually will keep on getting giddiness. Whenever the patient stands up or sits up from a lying down position, he may have postural drop of blood pressure, which can cause dizziness, sometimes even fall, and he can even fracture. So autonomic neuropathy is a very dangerous thing. It usually happens to a long-standing diabetic patient, and the sad part about it is there is no specific treatment for autonomic neuropathy. It's pretty simple if you try to understand these 10 fingers. So all you need to remember is these 10 things which I am going to tell you. You should be avoiding sugar, jaggery and maida. Maida means refined flour. 3 things to be totally avoided. 2 things in moderation, that is salt and oil. Try to eat less of salt and less of oil. So all you need to remember is these 5 things: no sugar, jaggery and maida, salt and oil to the minimum. Rest everything you can have in moderation. You can have rice in moderation, limited proportion of rice. Try and avoid potatoes. Now coming to sugar substitutes, basically you can have sugar substitutes like sucralose. Aspartame should be avoided, or you can have sugar substitutes like stevia, which are natural. They are quite safe, and even in pregnant patients they can be used, like sucralose and stevia. Even a pregnant lady may have. Now coming to fruits, basically you can have all type of fruits. Preferably try and avoid these 5 fruits: chiku, custard apple, grapes, mangoes and bananas. But try and eat fruits rather than drinking fruit juices, because fruit juices won't be containing fibers. So the absorption is going to be rapid and the sugar rise is going to be rapid. So try and chew and eat fruits. So basically I told you these 5 things to be remembered: no sugar, jaggery and maida, salt and oil to the minimum. Now coming to these 5. Diabetic patients should be eating in small and frequent breaks. They should not be having huge meals at a time. 9 a.m. breakfast, 9 p.m. dinner. Between the two, 1 p.m. should be your lunch. Between the breakfast and lunch, somewhere around 11 a.m. you can have a small fruit. And between the lunch and dinner, that is somewhere around 5 p.m. you can have a small snack, evening snack. So try and eat in small and frequent breaks so that the sugar fluctuations are not very huge. So all you need to remember is these 10 things, and I think diet can't be more simpler than this. I'll give you a simple example of how lifestyle plays an important role in causing any chronic disease. So basically I'll give you an example. A gentleman who is roughly around 75-year-old, he is my patient. His son, who is somewhere around 52-year-old, he is again my patient. And now his grandson, who is just 20-year-old, has become diabetic. Now this gentleman asked me, why is it so that I developed diabetes at the age of 75, my son developed diabetes at the age of 45, and now my grandson is developing diabetes just at the age of 20. So I told him in simple language, whatever amount of cokes, burgers and pizzas you had in 75 years, your son had in 45 years, and your grandson has already completed his quota of all these fast food, burgers and pizzas. Whatever you had exercised, your son hardly exercised, and your grandson has never ever exercised. He just got out of his room, stepped into the car, went to his college, came back and never used his feet. So obviously he had to become diabetic. The mental stress which you faced was minimal those days. Your lifestyle was much better. On the other hand, your son's lifestyle, the mental stress which he has faced was much more than that. And your grandson is exposed to enormous stress, competition in today's life, fierce competition. So obviously he had to become diabetic at such a young age. So basically, though the genes are same, the environment is changing, and we have to understand that the environment has a major role in causation of these chronic diseases, and that is why diabetes is happening. Now, can you change the entire environment? Definitely no. I mean, you can't change your surrounding, you can't change anyone and everyone who happens to be a part of your life, but at least you can try and follow a good lifestyle. Suppose you have developed diabetes, and if you are in a very early stage of diabetes.
मैं डायबिटीज़ का एक सिंपल डाइट बताती हूँ आपको. मेरे हिसाब से सिर्फ 10 उंगलियाँ याद रखिए. पहले ये 5 उंगलियाँ. शक्कर नहीं खाना है, गुड़ नहीं खाना है, मैदा नहीं खाना है. ये 3 चीज़ों से बना हुआ कुछ भी नहीं खाना है. शक्कर, गुड़ और मैदा. नमक कम खाइए, तेल कम खाइए. तेल मतलब तेल, घी, बटर, मस्का चीज़ सब कुछ कम. चावल थोड़ा सा खाना है आपको, 4 चम्मच. आलू का भाजी नहीं खाना है. सलाद में आप सब सलाद खा सकते हैं, सिर्फ बीट और गाजर ज़्यादा नहीं खाना है. जूस नहीं पीना है, बीट का जूस नहीं, गाजर का जूस नहीं, नारियल का पानी नहीं पीना है, और कोई भी फल का रस नहीं पीना है. फल चबा के खाएंगे तो चलेगा. फल में आपको सब फल खा सकते हैं, सिर्फ 5 फल आपको कम खाना है. चीकू, सीताफल, अंगूर, आम और केला, ये 5 फ्रूट आपको कम खाना है. बाकी सब खाइए लिमिट में. दूध में गाय का दूध पीजिए, भैंस का दूध नहीं. टोस्ट, खारी, बटर, पाव, ब्रेड, ये सब मैदे की चीज़ें, तो मैदे की चीज़ें नहीं खाना है. मांस, मटन, मच्छी में आप बकरे का मटन मत खाइए. मुर्गी का खाएंगे तो चलेगा, लेकिन वो भी कम खाना है. अंडे में पीला नहीं खाना है, सफ़ेद खाएंगे तो चलेगा. मच्छी खाइए, लेकिन तला हुआ नहीं खाना है. ऐसे बराबर से 5 उंगलियाँ याद रखिए. शक्कर, गुड़ और मैदा नहीं खाना है. नमक कम खाइए, तेल कम खाइए. अभी ये 5 उंगलियाँ. डायबिटीज़ के पेशेंट ने दिन में थोड़ा थोड़ा 5 बार खाना चाहिए. एक टाइम बहुत सारा मत खाइए. देखिए, मैंने 5 उंगलियाँ बताई. अभी ये 5 उंगलियाँ. डायबिटीज़ के पेशेंट ने दिन में थोड़ा थोड़ा 5 बार खाना चाहिए. एक टाइम बहुत सारा मत खाइए. सुबह 9 बजे नाश्ता, रात को 9 बजे खाना. इसके बीच में बराबर 1 बजे दोपहर का खाना. देखिए, सुबह का नाश्ता 9 बजे, दोपहर का खाना 1 बजे. इसके बीच में 11 बजे एक फल खाइए या कुछ नाश्ता कीजिए, और शाम को 5 बजे थोड़ा कुछ नाश्ता कीजिए. मतलब ही थोड़ा थोड़ा दिन में खाएंगे तो शुगर अप एंड डाउन नहीं होगा. तो मेरे हिसाब से ऐसे बराबर से 10 उंगलियाँ याद रखिए, तो आपको डायबिटीज़ का डाइट याद रहेगा. फॉर एग्ज़ाम्पल, चना ले लीजिए. अगर आपको चना खाना है तो चने में शक्कर नहीं है, गुड़ नहीं है, मैदा नहीं है, तेल भी नहीं है और नमक भी नहीं है, तो खा सकते. सपोज़ आपको सिंगदाना खाना है तो सिंगदाने में शक्कर नहीं है, गुड़ नहीं है, मैदा नहीं है, नमक भी नहीं है, पर तेल है ना, शिंगदाने का तेल बनता है, तो नहीं खाना है। सपोज़ आपको पाव खाना है, तो पाव में शक्कर नहीं है, गुड़ नहीं है, लेकिन मैदा है, पाव मैदे का बनता है, तो नहीं खाना है। सपोज़ आपको अचार खाना है, तो अचार में शक्कर नहीं है, गुड़ नहीं है, मैदा नहीं है, पर तेल बहुत ज़्यादा है और नमक भी बहुत ज़्यादा है, तो नहीं खाना है। सपोज़ आपको पापड़ खाना है, तो पापड़ में शक्कर नहीं है, गुड़ नहीं है, मैदा नहीं है, बट नमक बहुत ज़्यादा है, तो नहीं खाना है।